Welcome to Module 2 of the Inclusion of Special Populations Training, 703 KAR 5:070. My name is Krista Mullins, and I'm a program consultant in the Office of Assessment and Accountability. Module 2 will discuss the inclusion of students in state-required assessments, including students with an IEP, 504, English learners, as well as students on home or hospital instruction and alternate assessment. There will be some allegation prevention and best practices tips and a check for understanding at the end of the module. Let's take a look at the inclusion of students. Some students receive accommodations dictated by an IEP. This information can be found on pages 8 through 13 of the regulation document. One of the focal points in this section is the importance of intentionally selecting accommodations based on evaluation information, observations, and progress monitoring data. When age appropriate, students should be involved in the selection and use of accommodations. Everyone involved with testing is required to complete the administration code training. This particular training, Inclusion of Special Populations, is designed for those providing accommodations. Many districts choose to train all testing staff in both regulations to increase the number of trained staff available to provide accommodations. Any person not working in a certified position who is providing accommodations for special populations shall read and sign a non-disclosure agreement provided by the department. Section 2 of the Inclusion of Special Populations Regulation focuses on students who are identified as English learners or EL. This information can be found on pages 13 through 19 of the regulation document. Students who enter school and have English as a second language will be administered the home language survey as the first part of the screening process. If a student is determined to be an EL student, a district or school committee must convene to design a program service plan, or PSP, which determines instructionally consistent accommodations for the assessment administration. EL students do not receive accommodations on the annual English language proficiency assessment unless they have a 504 or IEP. This is because that assessment measures the English language ability of the student. A student's score on the annual English language proficiency assessment determines whether the student identified remains EL or attains English language proficiency status. For all EL students, PSP committees shall determine on an individual basis whether these students will participate with or without accommodations in the state-required assessment and accountability programs. Because those assessments measure content knowledge, these accommodations shall be related to demonstrating what each individual student knows on a test written in English and the ability to access the curriculum. Individuals providing assistance to a student with disabilities during the state-required content assessment shall be trained in their responsibilities yearly and sign a non-disclosure if not working in a certified position. All EL students must participate in the state-approved English language proficiency tests annually. This is regardless of time enrolled in a U.S. school. They must also participate in all state-required content assessments after 1 full year, which is defined as 240 cumulative days or 12 cumulative months. First-year EL students must participate in a mathematics test with appropriate accommodations if they are enrolled in a grade in which a mathematics test is administered. Likewise, they must participate in a science test with appropriate accommodations if they are enrolled in a grade in which a science test is administered. EL students in their first year of enrollment in a U.S. school qualify for a one-time exemption. Section 3 of the Inclusion of Special Populations Regulation discusses students who have a 504 plan or medical emergency. This information can be found on pages 19 through 23 of the regulation document. Anyone who qualifies with a 504 must have a current plan. The 504 plan focuses more on use of an accommodation due to a health impairment instead of accommodations related to learning disabilities. The other part of this section focuses on medical emergencies. Examples include a student with a broken dominant arm or temporary paralysis due to illness who is now eligible for a scribe, or a student with a concussion who requires a human reader due to not being able to medically focus on a computer screen or paper test for a long period of time. Appropriate documentation must be kept on file at the school or district level and is not required to be submitted to KDE. Section 4 of the Inclusion of Special Populations Regulation focuses on students who receive services through an alternative program. This section also talks about the requirements of state agency children. This information can be found on pages 23 through 24 of the regulation document. Students attending programs classified as alternative programs shall be included in the overall accountability program system. Alternative programs are considered non-A1 or non-accountable programs. This does not always mean alternative placements for behavior. It applies to any alternative program that a student attends because that service is not available at their school or district of accountability, where they would be enrolled if they did not need that service. Kentucky School for the Deaf and Kentucky School for the Blind are examples of programs that provide programs to students who would not be able to receive those services at their school of accountability. State agency children, students who have been ordered or placed by the courts, are also expected to complete all state assessments unless an approved non-participation would apply. Section 5 of the Inclusion of Special Populations Regulation focuses on students who receive services in a homebound or hospital setting. This information can be found on page 24 of the regulation document. This does not include students who have withdrawn to homeschool. School personnel shall determine on an individual basis how each student will participate. The student may participate fully, or the district may seek a medical exemption. If participation in the state-required content assessment would jeopardize a student's physical, mental, or emotional well-being, a school or district shall submit a medical non-participation request. An identified disability or handicapping condition alone are not grounds for a medical non-participation. Requests are subject to KDE approval. Section 6 of the Inclusion of Special Populations Regulation focuses on students who participate in the Kentucky Alternate Assessment. This information can be found on pages 24 through 29 of the regulation document. Students who qualify for the Alternate Kentucky Summative Assessment, or AKSA, are not able to access the general curriculum in the same manner as their peers, even with access to accommodations. The content, while reflecting some grade content standards as peers, may need to be heavily modified for access and student demonstration of concepts. Students participating in the AKSA are expected to follow the same guidelines for use of accommodations. However, there are differences in the accommodations of reader and manipulatives. These students do not have to request a reread. They may also have labels but no content on their 3x5 note card. In order to participate in the AKSA, the ARC consider the participation guidelines established by the Kentucky Department of Education. A student may not qualify unless the ARC can answer yes to all parts of the guidelines. If a no is determined at any time, then the student would not qualify for participation. A direct link to those participation guidelines can be found on this slide. This allegation prevention or best practice tip is to highlight specific training requirements. First, anyone who is involved in a state assessment must receive the administration code training. Those providing or assisting with accommodations must receive the administration code and the inclusion of special populations trainings. Many districts do require both trainings to be completed by all test administrators and parties involved with state assessments. That is a local decision that may be enforced without the consent of KDE. It is time for our second check for understanding, which will cover information about students who are included in state assessments. Please pause the video and take a few minutes to read and answer these yes or no questions, and then resume the video so we can discuss. Number 1, do students who are in an alternative placement or state agency have to take the required assessments? The answer is yes. Students in alternative placements and state agency students have to take required assessments. This can be found on pages 23 and 24 of the regulation. Number 2, for EL students, is 1 year of enrollment defined as 240 cumulative school days or 12 cumulative months? The answer is yes. 1 year of enrollment is 240 cumulative school days or 12 cumulative months, found on page 15. Number 3, do districts have to send medical emergency documentation to KDE? The answer is no. Forms completed should be kept at the local level, page 19. Number 4, are students who have withdrawn to homeschool required to take the state required assessments? The answer is no. While students who receive homebound or hospital instruction are not automatically exempt from state required assessments, students who have completely withdrawn to be homeschooled are not required to complete state assessments. This includes students who may come to the school to receive services, such as speech or OT, but are not enrolled in that school for their primary enrollment. Page 24. This concludes Module 2 of the Inclusion of Special Populations Regulation training. Please progress through all 4 modules to complete the training. If you have any questions about anything we discussed or require further clarification, please contact our office by emailing dacinfo@education.ky.gov or by calling 502-564-4394.